A very good evening to one and all. I am Naman.
I'm Soham.
I'm Divansh.
I'm Sanvi.
And together we are the
NSDS Innovators.
We are from AMS P Obal Reddy Public School, Hyderabad. Together we have observed the problem that in hospitals whenever someone is admitted, they are given saline through saline bottles. But once this saline goes to a lower level, it is very fatal for the patients since the blood starts flowing backwards, causing stress, anxiety, etc. and eventually the patient is going to die. Therefore, we came up with the intravenous fluids indicator to give the nurse a sigh of relief and reduce her work tenfold.
We came up with this idea as one of our team members' aunt was a doctor who told about the problem faced by the paramedic staff. So we interviewed one of the nurses and knew the problem she was facing and tried solving her problem by the IV fluid indicator.
To solve this issue, we made an IV fluid indicator. In this prototype, we used an Arduino, a load cell and a battery. We have coded the Arduino in such a way that the load cell weighs up to 1 kg. Whenever the saline which is placed on a hanger reaches below the level of 60 ml, then the buzzer beeps and the indicator glows indicating the nurse. Here in this prototype we have used the low level point as 60 ml, but it can be coded into up to any low level point. In our future developments of this prototype, we are thinking to place knobs which depict the low level point, and also we are thinking to use a transmitter and a receiver. A receiver can be placed at the nurse station, which will give the indication to the nurse that that is the time for the saline to be replaced.
There are many advantages of this. The main advantage is that the nurses get a sigh of relief as the project works for them, as this model works for them, and they can attend other patients. For example, during the pandemic situation, a lot of patients came into the hospital. So in such situations, it's very difficult for the nurse to keep a constant check on every saline bottle. So in such situations, this can be very helpful. Also, this is a small step to the fulfillment of UNSDG 3, which is good health and well-being. The model which we have made is very cost effective, and it costs around 900 rupees so that it can be afforded by economically weak people also. We are going to show the working model of it.
First, the nurse has to manually switch on the button.
Put the mic towards the buzzer.
Whenever the buzzer beeps, the nurse has to place a completely filled saline bottle. The buzzer will stop beeping. But as soon as it reaches the level below 60 ml, then the buzzer again starts beeping and the indicator glows. In this way, it will indicate the nurse. Thank you.